Have you ever had a day when your pain felt different, deeper, or suddenly more exhausting than usual? Maybe you woke up with your joints feeling heavier than they should, or your back aching in a way that made even simple movements feel overwhelming. So many seniors tell me they assume these moments are just part of getting older, something they're supposed to live with. But what if the pain you feel is hinting at something your body wants you to notice? One of my longtime patients once shared a moment I will never forget. She said, "I thought it was just arthritis, but it almost cost me everything." She had lived with constant knee and hip pain for years, brushing it off as something she was used to. It wasn't until she experienced a small stroke that she finally learned how much her chronic pain had been affecting her body long before that day. I want you to imagine this. You're sitting in your favorite chair, dealing with the same familiar pain you've carried for years. Nothing dramatic, nothing alarming. But inside your body, silent inflammation is building, your blood pressure is rising, your heart is working harder than it should. And without your knowledge, your stroke risk is slowly climbing higher and higher. Chronic pain is not just discomfort. It is a physical stress signal, one that affects your hormones, your nerves, your circulation, and your brain. Long-term pain activates stress chemicals that raise blood pressure. It disrupts heart rhythm. It inflames blood vessels. Together, these changes create the perfect conditions for a stroke, especially in older adults who already have more delicate vessels and a more vulnerable nervous system. In this video, I want to guide you gently but clearly through the truth behind chronic pain and stroke risk. We will talk about why pain and stroke are more connected than most people realize. We will uncover early warning signs seniors often miss. We will explore the hidden triggers inside your daily pain and the simple changes that can protect your brain and your independence. And I will share real stories from seniors who never knew their pain was quietly shaping their health. If you care about your long-term health, remember to subscribe, like, and share Senior Health Daily so we can support you every step of the way. In the next part, we will begin our deep dive into the science and the stories that every senior needs to hear. Why chronic pain sends stroke risks soaring. Chronic pain changes a person in ways that are both visible and invisible. When seniors live with daily discomfort, the body enters a constant stress response. You may feel it on the surface as aching joints or a burning spine, but deep inside, your heart and blood vessels are working overtime. The body responds to long-term pain by releasing stress hormones like cortisol and adrenaline, which keep blood pressure elevated far longer than it should be. This constant pressure slowly weakens artery walls, making them more vulnerable to clots, plaque buildup, and the tiny ruptures that can start a stroke. What makes this so dangerous is that seniors often move less when they hurt. They avoid stairs, they avoid long walks, and they sit for longer periods. Stillness may feel comforting, but internally it slows circulation. Slow blood flow gives clots the perfect environment to grow, especially in older adults whose vessels are already narrower and more delicate. I cared for a man who had lived with knee pain for nearly a decade. The pain made him hesitant to move, and gradually his activity level dropped. Over several months, his blood pressure rose without him noticing. Nothing dramatic happened at first, only a few days of feeling unusually heavy or tired. Then, one afternoon, after a particularly painful flare, he experienced a stroke that changed everything. Later, he told me he never imagined his knee pain could have contributed to something so serious. Chronic pain also fuels inflammation that travels through the bloodstream. That inflammation thickens blood, stiffens arteries, and creates tiny injuries inside blood vessel walls. Older adults already face natural vessel narrowing, and when inflammation is added, the risk multiplies quickly. This is the hidden danger. Pain is not just discomfort. It is a full-body event, shaping hormones, circulation, blood pressure, and vascular stability in ways that silently raise stroke risk every single day. As we dive deeper, I want you to hold on to a simple truth. When the body hurts, the heart and brain feel it too. Hidden stroke triggers linked to chronic pain. Many seniors are surprised to learn that pain does more than hurt. It activates a chain of reactions that quietly raises stroke risk in places most people never think to look. Inflammation is one of the major culprits. When pain persists, the body produces inflammatory chemicals that damage artery walls. Over time, these damaged areas become sites where blood clots can form or where plaque becomes unstable. Either situation can block a blood vessel leading to the brain. Pain-related blood pressure spikes are another overlooked trigger. Anyone who has experienced a sudden burst of pain knows that it can make the heart race and the face flush. These spikes, when they occur repeatedly, strain delicate blood vessels in the brain and significantly increase the chances of a stroke. Pain also robs seniors of restful sleep. Night after night they toss and turn, shifting positions to find relief. Sleep deprivation raises vascular stress, weakens the immune system, and increases hormones linked to stroke events. This connection between pain and poor sleep creates a cycle where the body never fully recovers. Reduced movement slows circulation, creating pockets of stagnant blood that can form clots. Emotional distress also plays a major role. Chronic pain often leads to frustration, anxiety, and even depression. Emotional stress strains the heart and affects vessel stability. One of my patients, a woman in her 70s, had chronic back pain that flared unpredictably. During one bad week, she felt exhausted and assumed she was simply worn out from dealing with the pain. She did not know those moments of fatigue were her body signaling vascular distress. 2 days later, she suffered a transient ischemic attack. During her recovery, she told me she wished she had taken her exhaustion more seriously because it did not feel like her usual tiredness. Even medications can become hidden triggers. Overusing certain pain relievers may affect heart rhythm or blood consistency, adding more risk on top of the pain itself. Silent microinflammation that starts in the joints can spread into the bloodstream, creating the perfect environment for a stroke long before symptoms appear. Chronic pain creates a web of silent, interconnected risks that many seniors never hear about until it is too late. Neurological symptoms. Seniors mistake for pain exhaustion. One of the most heartbreaking patterns I see in older adults is the misinterpretation of early neurological symptoms. Seniors often believe their body's warning signs are simply fatigue from a painful day. They do not realize that subtle neurological changes can be the first signs that a stroke is forming. Sudden heaviness in the limbs is one example. A senior may think their leg feels heavy because arthritis flared or because they walked too much. But heaviness can also signal early brain circulation problems. Difficulty lifting arms or legs may appear to be stiffness or soreness, yet it can indicate that part of the brain is struggling to send signals properly. Brief episodes of confusion often get passed off as brain fog or tiredness, especially when pain already makes thinking difficult. A moment of zoning out may seem harmless, but it can be a small neurological misfire. Vision blurring is frequently mistaken for eye strain, especially if someone has been lying down due to pain. However, changes in vision can occur when blood flow to the visual centers of the brain becomes disrupted. Unusual headaches are often dismissed as tension from pain, but sudden or different headaches deserve attention. Trouble forming words or finding the right words can be mistaken for fatigue or frustration, yet they are among the earliest and most important stroke symptoms. Hand weakness, especially when gripping everyday objects, is one of the most overlooked signs. Many seniors attribute this to arthritis or nerve pain, not realizing the brain may be involved. Imbalance after standing up or difficulty walking in a straight line is frequently mistaken for stiffness or soreness. But when the body cannot coordinate movement properly, it is often a sign of neurological distress. The tragedy is that so many seniors believe these symptoms belong to their familiar pain conditions, when in reality, they are the body's quiet call for help. The body's silent warnings: pain, stress, and vascular damage. Chronic pain shifts the body into a prolonged state of inflammation. This inflammation does not stay local. It travels through the bloodstream, affecting vessel walls and making them more fragile. Over time, these vessels can become damaged. Damaged vessels lose their flexibility, making it harder for blood to pass through smoothly. The body, in its attempt to heal the damaged areas, creates plaque deposits or encourages clot formation. Both conditions increase the likelihood of a blockage that can lead to a stroke. Stress from long-term pain also affects the body's internal chemistry. When the body releases stress hormones day after day, the cardiovascular system takes on an enormous burden. Blood pressure rises, heart rhythm becomes more irregular, blood vessels harden more rapidly. All of these changes create a landscape where a single moment of inflammation or pressure can trigger a major medical event. Research consistently shows that seniors with chronic pain face a significantly higher stroke rate compared to those without persistent discomfort. What makes this so concerning is that the warning signs rarely feel dangerous. They feel ordinary. They feel like aging. But underneath those small moments, the body is preparing for something far more serious. The body whispers before it cries out, and pain is one of its earliest whispers. High-risk groups among seniors with chronic pain. Not all seniors face the same level of risk. Some groups are especially vulnerable because their pain conditions already affect circulation, inflammation, or mobility. Seniors with arthritis or joint degeneration are at higher risk because their pain is persistent and often involves swelling. Individuals with neuropathy experience nerve-related pain that changes mobility and disrupts the nervous system's communication between the brain and limbs. Chronic back and neck pain limit movement and create tension that affects circulation to the brain. Seniors who rely on daily medications like NSAIDs or opioids may also experience changes in blood pressure, blood thickness, or heart rhythm. Patients living with diabetes or obesity face compounded risks. Their blood vessels are already under stress, and inflammation from chronic pain adds another layer of danger. Seniors who struggle with limited mobility or long periods of inactivity experience slower circulation, which greatly increases clot formation. I once treated a patient who relied on a walker due to severe hip pain. She believed her exhaustion was simply from struggling to move. What she did not realize was that her limited mobility had started to affect her circulation dramatically. The tiredness she felt was not only from effort, it was one of the earliest warnings her brain was sending. She later told me she wished someone had explained how her pain, mobility, and stroke risk were intertwined. These vulnerable groups deserve special attention. Their risks are real, but with awareness, they can be managed. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. How seniors can protect themselves from pain-related stroke risks. Protecting your brain begins with recognizing what your body is trying to tell you. When pain intensifies or lasts longer than usual, check your blood pressure. Many seniors notice spikes during flare-ups, and these moments are critical. Monitoring your numbers can reveal patterns you might not otherwise see. Gentle movement is essential. Even slow, short walks can improve circulation enough to reduce clot risk. Hydration is one of the simplest ways to help your blood flow more smoothly. When the body is dehydrated, blood becomes thicker and harder for the heart to pump. Drinking water throughout the day is a powerful form of stroke prevention. Reducing sodium intake is equally important. High-sodium meals contribute to fluid retention and raise blood pressure, especially in seniors with chronic pain. A diet rich in berries, leafy greens, and foods containing omega-3 fatty acids helps calm inflammation. Physical therapy, heat therapy, and stretching can help manage pain without relying too heavily on medications that may increase heart or vascular risks. Seniors should also pay attention to any new or unusual symptoms that appear on top of their normal pain. A sudden headache, a wave of confusion, or an unexpected weakness should never be ignored. Knowing when to call 911 is one of the most important tools you have. If something feels different or alarming, trust that instinct. Your body is guiding you. Prevention happens long before symptoms become severe. Caring for circulation, inflammation, and stress is one of the most powerful ways to protect your brain and your independence. Pain is not just discomfort, it is communication. It is the body's way of asking for attention and care. When we ignore those messages, we allow inflammation, stress, and circulation issues to work quietly in the background. But when we listen, when we take action, we give ourselves the chance to prevent crisis and maintain control over our health. Your body speaks long before anything serious happens. Learning to hear those whispers can change everything. As we come to the end of this journey together, I want to circle back to the heart of our message. Chronic pain is not something you simply have to endure because of age. It is not just stiffness, soreness, or the familiar aches you have learned to live with. Chronic pain is the body's early language, a collection of quiet warnings spoken long before a stroke ever arrives. Your body is always trying to protect you, always trying to guide you. And when you learn to listen, you give yourself the gift of safety and control. So many seniors believe pain is just another part of growing older, but awareness transforms everything. Awareness lets you recognize when something feels different. Awareness helps you catch the small changes in circulation, thinking, balance, or energy that might otherwise go unnoticed. Most importantly, awareness preserves the things that matter most to you: your independence, your mobility, your clarity, your dignity. I once cared for a patient who lived with daily back pain. For years, he pushed through it, believing it was nothing more than the cost of time. After his stroke, he sat with me and said, "If I had understood what my pain was trying to tell me, everything might have been different." His words stay with me because they reflect what so many seniors feel in hindsight. You deserve to understand your body's signals before it reaches that point. Thank you for spending this time with me. Thank you for caring about your health and for trusting me to walk this path alongside you. Your willingness to learn and to protect your future is a beautiful act of self-respect. Stay aware, stay hopeful, and remember that your health is worth protecting every single day.